Hello and welcome to this video on disease outbreak investigation. So in today's lesson, we'll take a look at what an outbreak is, how it is detected, investigated, and controlled. And if you are new here, don't forget to subscribe and turn on notifications so you never miss an important health topic. First of all, what is an outbreak? So an outbreak happens when there are more cases of illness than what is normally expected in a population in a specific place and at a specific time. For example, if normally a clinic sees 2 cases of measles in a month, by sudden sees 10 cases in a week, that is an outbreak. So the word outbreak and epidemic are sometimes used to mean the same thing. The next question is, how do we detect outbreaks? Outbreaks are usually detected through surveillance systems. Surveillance simply means the continuous monitoring of diseases in a community. There are different types of surveillance. We have passive surveillance, where health facilities routinely report cases that come to them. We have active surveillance, where health officers actively search for cases, for example by visiting hospitals or communities. We have sentinel surveillance. This is where special selected institutions or groups report health data to act as an early warning system. Syndromic surveillance, which involves monitoring of illness syndromes like fever, diarrhea, even before a lab test confirms the disease. Outbreak can also be detected through other sources like media reports, social media, or even community rumors. Once we suspect or confirm an outbreak, the next stage is to investigate it. So outbreak investigation usually follows a number of systematic steps. So the exact order may change depending on the situation, but the key steps are always included. So let's go through them one by one. The first step is to confirm the existence of an outbreak. To confirm an outbreak, we first compare the current numbers of cases to the baseline level, which is the normal expected number of cases in that community. So if the cases are higher than the expected, then we have an outbreak. But sometimes the increase may look false. For example, maybe testing increased suddenly, or maybe the population grew. All this must be ruled out before confirming the outbreak. After confirming the existence of an outbreak, now verify the diagnosis. So at this stage, we make sure that the disease is really what we think it is. So doctors review clinical findings, meaning symptoms and signs in patients. Scientists also do laboratory tests, for example, stool culture in cholera or blood test in malaria. This ensures we do not confuse one disease with the other. The next step, organize the investigation team. An outbreak cannot be investigated by one person. A team is needed, and this team usually includes epidemiologists, laboratory scientists, environmental or public health officers, and clinicians. So the size of the team depends on the type and the size of the outbreak. Define and identify cases. Here we create a case definition. This is a set of rules to decide who counts as a case in the outbreak. For example, any person in Lusaka district with watery diarrhea between July and August 2025. So once the case definition is set, we look for cases in hospitals, clinics, and communities. The data is obtained systematically and often using questionnaires. Describe the outbreak. This is one of the most important steps. Here we describe the outbreak in terms of time, place, and person. For time, when did the case occur? We show this on a graph called an epidemic curve. In a point source outbreak like food poisoning from a single meal, the curve rises sharply and falls quickly. In a propagated outbreak like measles spreading person to person, the curve shows several peaks over time. In terms of place, where are the cases located? So when we look at the map, we can see that some cases are close to each other in one place. This means there is a hotspot of cases in that area. Person who is affected, we check the age, sex, occupation, and other factors. Develop hypothesis. A hypothesis is an educated guess about the source of the outbreak. For example, the outbreak was caused by contaminated water from the bore X. The next step is evaluate hypotheses. Now we can test our guess using studies such as case control studies that compares those who are sick with those who are not. We can also use cohort studies that follows up group to see who develops the illness. If the data supports the hypothesis, we are closer to solving the outbreak. Define the hypothesis and conduct additional studies. So if the first hypothesis is wrong, then we define it and test again until we find the true source. Implement control and prevention measures. So control measures should be started as soon as possible, even before the final report. Examples include providing safe water, giving vaccines, treating patients, educating the public, isolating infectious cases. Finally, the findings must be communicated, and this can be done through reports to the health authorities or updates to the community. And remember, good communication prevents panic, builds trust, and helps future prevention. So an outbreak investigation is not just about science, it's about saving lives. So every step from detecting the first case to controlling the last protects families, communities, and nations. And when done well, outbreak investigation turns confusion into clarity, fear into action, and danger into safety. So thank you for watching, and if this video was helpful, please like, share, and subscribe for more simple explanations of health. Stay safe.